family. I have returned. I am back to do episode number 7 of the Myo Minute. I have been MIA because I have been dealing with the world's longest case of laryngitis. So no voice, no recording episodes. So in this episode, I'm going to be talking about what interventions to prioritize. So what do I mean by interventions? That's a weird word to use. Basically, we're going to talk about what other humans we might need on the comprehensive wellness team and in what order, okay? So let's just dive into some examples. This is always an area that seems to overwhelm people when I do an exam and then I'm saying, hey, we need some other humans, and what orders do we need this? So we're going to talk about a few. This does not necessarily mean all of them, but it's going to at least help you understand why I'm the person who helps prioritize those things. So what happens is a lot of the time, doctors, dentists, some osteopaths will do it. Orthodontists will say, hey, I see problem A, B, and C, but we need you to see Carmen, get an exam, and she's going to tell you what we should do when, okay? So first, ENT or allergist. If you cannot comfortably nasal breathe, then we need these people. I can't start therapy with you with one of our prime focuses to be on nasal breathing if you've got a problem with the plumbing. So if you can't comfortably nasal breathe, then we might need an ENT. So that would be a priority to become first before starting therapy. Sometimes with an allergist, we can start therapy because nasal breathing just is not super comfortable for you. But getting the help of an allergist, sometimes just getting an over-the-counter allergy medicine to help you break that cycle of the congestion, so your mouth breathing. That was me, you guys. Remember, I used to take 4 allergy pills a day, and I just slowly titrated them down. So when we're talking interventions and what to do, sometimes we need an allergist before we can get started. Sometimes maybe we don't need an allergist. We just need, something over the counter to help you. And that's something that we talk about during an exam. Sometimes we need a nutrition therapist. Remember, I'm just now graduating from nutrition therapy school, and how this really ties into working with my clients now is if you can't nasal breathe comfortably, are you exacerbating the problem? Do you have food sensitivities or allergies? Many people do not know this, but alcohol, dairy, gluten, and sugar are the 4 biggest inflammatory causing agents. These and other things might be causing chronic inflammation. Toxins, environmental chemicals, that type of stuff. It took me several years to finally believe and understand that I needed to get all of the, as many toxins as I could out of my environment. Now you can't get all of them. And to get rid of things like synthetic smells, synthetic scents. I don't use Tide laundry detergent because those are forever chemicals that are in there. They're meant to be on your clothes forever. So while you smell wonderful, or you think that you smell bounce fresh, it is exacerbating congestion. Okay, the same with chemicals. The only smell in my home that I really use is 100% pure essential oil. So enough about that. Airway ortho. So sometimes we need to prioritize this, you guys. Airway and sleep are number 1 priorities. So do we need a sleep doctor? Do we need to see airway ortho? Do we need expansion? Do we need a sleep study? All of those things are things that we prioritize. Sometimes we can start therapy while getting those people on board. Sometimes it is, do not pass go, do not collect $200, we need a sleep study, or we need intervention right away. So sometimes for kiddos who really have severe sleep problems, they end up having sleep apnea and they need a CPAP like pronto, okay? Speech. So sometimes we need a speech therapist. This is an intervention that we also need to plan for, but it needs to be at the right time. Many of my clients come from the world of speech therapy. They've been doing it. They've been spinning their wheels. They're not sure why, and they really have a significant tongue tie. Makes a big difference, okay? So a lot of my clients will need to complete speech therapy, but they're going to do it after we've prepped the muscles and rehabilitated from the tongue tie. Tongue tie. So again, this needs to be the right person, not Joe Blow down the street. Not everybody needs to be releasing tongues, although they all know how to. All dentists know how to. There's a lot of different providers who will do it. An ENT can do it. I don't know if that's the human that should be doing it. Oral surgeon, again, the same thing. And what really matters when I say whether they should be doing it or not, do they know about myofunctional therapy? Do they mandate myofunctional therapy? Do they know that you need to do pre-procedure therapy? In my case, with my clients, I do it for a couple months at least before we're ready to have that done. So if somebody is saying, yeah, you have a tongue tie, yes, I can release it for you. I've got 5 minutes, can I do it? The answer is no, okay? And then you really need to also be considering postural re-education, manual therapy, body manipulation, all of those things. So a lot of people use the term body work. It's not just a massage, you guys. So craniosacral therapy has definitely an important place at the table. Quality chiropractic care has a place at the table. Physical therapy is probably the most important. Posture is part of your breathing system. It's part of your swallowing system. If you have a tongue tie, you've got a postural problem. You've got a connective tissue problem. You've got a structural problem. So we need somebody to help support you as we make changes and as we kind of settle the house. That's what I call it when we get a tongue tie release and your body just starts to change. We need somebody to help you with that, okay? So you're probably wondering right now, who helps prioritize these things? That's me. I'm the travel itinerary director. I give that plan to you. We come up with a plan during your exam. And we get everybody on board, okay? So these are things, some things need to be done before I can start therapy with you. Sometimes these steps can happen afterwards. So it just depends on your symptoms, on your craniofacial development, as well as your goals for achieving optimum wellness, okay? So we don't take shortcuts around here. That's just not something we do. If you've been with me long enough, you know that we don't. So you can learn a lot more great stuff on my website, on YouTube, on social media. But I think probably the most important thing for you, if you're wondering if you think you've got concerns, then we should probably just start with an exam and go for there. So that is it, you guys, for this episode where we've talked about what interventions need to be prioritized and in what order. And I will be back next time and we will talk about another hot topic. Bye for now.